Welcome to Al-Majlis podcast by Emirates Hospitals Group. Our goal at Al-Majlis podcast is to update you with the latest advancements in medicine in order to improve health and well-being. My name is Dr. Wafa Faisal. I am a consultant pediatrician at Emirates Specialty Hospital, and today's episode we will be speaking about a very interesting topic, which is the importance of health checkups. For this, my guest for today is Dr. Wael Berro. Welcome, Dr. Wael, to Al-Majlis podcast.
Thank you very much, Dr. Wafa.
Before we start, I will be asking you to introduce yourself to our listeners.
Fair enough. My name is Dr. Wael Berro and I'm a family medicine consultant. I have done my training in Ireland. I'm originally from Lebanon. Before I did family medicine, I did internal medicine, so I'm dual specialist in both, and I speak Arabic, French, and English. And I'm working at the moment at Emirates Specialty, at Healthcare City, and at Emirates Marina.
So most welcome to Al-Majlis podcast, Dr. Wael. So our topic today is about health checkups in general. The first question will be, what is the importance of a health checkup?
Fair enough. Very, very good question, very good topic. And unfortunately, it's not well yet regarded as in kind of like a main reason to go see a doctor.
Yeah.
We see a bit difference in gender, and we probably might cover that in a minute. But the best way I describe it to people is that, especially those who drive, and most of us in Dubai drive, I always tell them, okay, you drive a car, you take it for maintenance.
True.
So I tell people a joke. If they're from Lebanon, for example, they wait for the lights to be on. For me, if a light is on, it means you're sick. So you have come because you're sick, you have a viral infection or bacterial infection, or because you have kidney disease. Whereas if your car is driving smoothly, you still take it and you do a minor service and a major service. And honestly, this is the best vision I have when I explain it to my patients. Saying, take the car, we can do oil and service. If there's a problem, we can talk about it. If we discover something early, we can prevent it, we can work on it. A lot of people are afraid, I don't want to know I have diabetes, I don't have symptoms, I don't want to take medications. And doing a checkup doesn't mean you will take medications. It just means fine-tuning, discovering things early, especially when we talk about silent diseases.
I like this very much, really, because you described it in a very simple way when you gave the example of the car. So always coming early and detecting things before they become in the late stage is the key in medicine and in treating all conditions. However, the world also is now in the medical field, is moving towards the preventive medicine. And this will be at least, we are aligned with the future of medicine.
Absolutely.
In this part. So now we know that health checkup is important. So what is a health checkup?
Very good. And just kind of that, preventive medicine is absolutely, this is the bread and butter of family medicine. That's what we focus on. It's actually health maintenance and how we can remain healthy and be healthy. A health checkup is really, though there are standardized one, and honestly, these days we'll have probably a machine that you can put your age, your gender, and then they will give you the stuff you need to do. It's very important whenever you visit a doctor that the health checkup has to be personalized. Yes, 80% might be the same for yourself or for your colleague or for myself and someone else with the same age group, but it has to be personalized. And what I mean by that, the family history, your social circumstances, your medical symptoms, your weight, your height, your age, your BMI. So we have to take certain things into consideration. And then if you have symptoms or not, because though people come in and they say that they're well, when we start questioning them, when I start asking them questions from head to toe, they start saying, you know what, you're right, I do have this chest pain that keep happening. I do have abdominal pain, I'm constipated. So then we have to focus a bit more. And this is what I call minor service. So the major service is the same, and it goes by age and gender, and it consists of coming to see the doctor, doing your blood pressure, your vitals, consultation.
Measurements are important.
Absolutely,
people
measurements.
Like numbers and
exactly. Do you have the Wii? Have you ever played the Wii back in the days? It's just kind of like measuring, and that's actually in a way you're taking certain vitals, assessing the heart rate. Then we kind of interrogate in a nice way, okay? But it's usually taking in-depth history from the patient, including their own history and the family history, their social habits. Do they smoke? Do they exercise? I always cover mental health in my checkup. We cannot separate physical and mental well-being. We're the same person. I'm always asked, okay, can you talk today about mental health? We can't, because I cannot ignore physical symptoms and focus only on mental, and vice versa.
Exactly. Knowing that stress is a major factor in all diseases
in your
in
symptoms,
medicine.
absolutely.
Yes,
in
it's
your
written
back
in
pain,
medical
in your
books.
palpitations.
Yes.
Then I try to take in-depth history, what I call personalized. So it's about you today, Wafa. It's like we're not going to say about just what's in the package. So about your needs, about your physical and genetic needs. And then we do a physical examination. Then usually there would be blood, urine, maybe stool test if needed, maybe some radiology if needed. So again, every person has different needs. There are, like I said, certain standards for most people, but we have to be specific as well.
Great. So knowing this about the checkup, is there any age that you cannot skip a checkup anymore? Like after a certain age, the men and women cannot skip a checkup anymore. And later I'll come to ask you about the differences between the genders, but we'll speak about the age first.
I'm personally a fan of any age group from early on to start doing checkups. Usually I have, and this is maybe intruding into your field as a pediatrician, I do get asked sometimes like, okay, I want to bring my 9-year-old for a full checkup and blood test. Now, usually I send them to the pediatricians, but I try to avoid that young age to do full checkup. From the age of 15, 18, of course, depending on the person onwards, yes. I believe that we have to do every 1 to 2 years initially, and as we get older, it's very important to do it at least once a year.
True.
And I'm sorry, I keep repeating the major and minor service. Maybe my car is due for servicing. Maybe that's why I'm obsessed today with that. But the idea is that if I find that, for example, your cholesterol is high, because it's a silent disease, you will not have symptoms. You will not come to me saying that I have a problem with my cholesterol. God forbid, the only reason you will come is because now you have heart disease. And now it's not too late, but we're level 2. So we want to do level 1 prevention. So if we have specific problems, then maybe it has to be more frequent. And then, of course, we have to monitor. And I keep saying, because I have a lot of patients saying, I don't want to do the checkup because I don't want to take medications. I will emphasize again, being told you have high cholesterol or a pre-diabetic doesn't mean immediate medications. Doctors, yes. We're not just selling medications like people see it. We are here to help, especially in family medicine. My job is about talking, about motivating, about emphasizing lifestyle. But as we get older, then of course we have to be more religious about it. Then we cannot skip. And if we discover you have renal disease, maybe you have to do it every 6 months or 4 months. So every person becomes different at that age and gender.
True. Yes, and very well said when it came to the age you started early with the, let's say, adolescence or the youth, because nowadays we see them so much into sports and they are overdoing sometimes their things between education and sports, and they really need to be checked. I can say from experience with my daughter, like she's into sports and she comes to me, Mommy, I'm tired. So we should not wait probably for this. We should be proactive and do the checkups regularly, even at a young age, like as you said, like above childhood probably, because children have their own checkups with us. So
but you're right, because
but adolescents should not be missed also.
She might have iron deficiency because of her cycles, or maybe some other vitamin deficiencies. And as you mentioned, now that people are more aware of the exercise, I have a lot of adolescents and young actually men, especially men, that got into the habit of taking supplements for the gym because they are focusing on muscle building. And that's it's good. We know that if it's done properly, it's safe. We think it's safe, but has to be monitored.
Under supervision
and I'm seeing a lot of people with borderline kidney disease that probably would go unnoticed if not checked early. So for me, anyone, for example, so if I take back to when we have to do it, if someone is taking creatine or taking a lot of protein supplements, I tell them, fine, okay, make sure that you're sticking to the guidelines, but make sure you check your kidney every 4 months or 6 months. Because if you wait, then it might be too late. And now we have chronic kidney disease rather than just mild kidney disease. So that's why it's important. And because a lot of these supplements are not regulated, they're not prescription. So some people, I had a patient a few weeks ago, he had no idea how much creatine he takes. He said, I just take a scoop or 2. I don't measure it. So of course I had palpitations that day.
Yes. There's so much in there. So to speak about, I know about the supplement word is another word also. Coming to the gender now. We know that we are now in October, the month of awareness about breast cancer, and November is coming, the month of awareness about men's diseases in general. So how often men should come for these checkups after a certain age of like 40, let's say, and women on the other hand also?
As I said earlier, I'm Irish trained. So a lot of the Western trained doctors, we follow what we call kind of the Western guidelines. Some people talk about NICE guidelines. Some people are from England, the NHS or the American. One thing we have to keep in mind that most of these guidelines were based on the concept of cost effective. Okay, so because the government used to pay for these people, they say, okay, don't check your prostate until you're 50. I don't do that. I don't do that because that's what I meant by individualized. If you have a family history of prostate cancer, if you have a strong family history of breast cancer, I'm not going to wait until you're 50 to order the first mammogram.
Exactly.
We can start
the
doing
guidelines
it
are changing now.
Absolutely. Guidelines definitely changing, and they have to be adaptable. There are lots of cultural differences. A lot of the Western guidelines didn't take that into consideration. A lot of the Western guidelines were mostly based on the cost on the government. So I'm not saying here that we have to abuse the test, but we start becoming more flexible. So for example, like today I had a patient this morning, strong family history of prostate cancer. He's only 42 now. I'm definitely doing prostate screen for him every year. So he's my regular patient for the last few years. If I follow the guidelines, then maybe I'm not doing it right. But if I follow the right medical practice for this particular individual, that's absolutely the right thing. Same concept for breast awareness. Now, very important point maybe to highlight it now is that going as well, touching back on the mental health element, it's very important for doctors in general not to emphasize the concept of sick role. Now, whenever, I won't say a patient, I would say a person, because we could be that person coming to see the doctor next week. Whenever a person comes in asking for help for a doctor, they're trusting them with their opinion. If I tell them this is very serious, you have to check your cholesterol every 3 months, but they don't really have high cholesterol, we've caused a lot of medical anxiety. And that's what we were saying earlier about that particular patient. Yes. It's very important to take that into consideration because it has these repercussions on that person's health, but also on the family around them. Because we have planted that seed that, oh my God, this is very serious, you have to check your blood every 3 months. If they're 1 day late, they come in panicking saying, doctor, I'm very late on my checkup. I should have done it last week. It's like, chill, it's fine, okay? We are not, I know I use the concept of cars, but we're not machines. Our body is way more complicated than that.
And as you said, this is not a sick care, it's a health care. So we have to encourage the part of health, and people should not be afraid. Because many people tell me, we don't want to go to the doctor because he will discover stuff in us, diseases and conditions. So no, we want to make sure you are healthy, not to discover diseases. So this is the concept.
We are there to help. I mean, you're a nice person. I could be scary. Maybe I can understand why doctors would be, some patients would be scared of me.
No.
But a joke aside, doctors are there to help. I mean, we are here to provide the best we can, the best of our ability for every person.
So we've known about now the difference between genders, women and men, and their checkups. And I want to conclude a bit, if I can, or summarize what you've mentioned. All the people need to do checkups for themselves at least once a year, but we'll be more serious about them above the age of 40. Correct?
Absolutely.
So coming to certain diseases that, for example, we can have them in the family, or we hear about them. Is there special screening for certain diseases that you recommend to the people to come and screen for them?
Part of the checkup, we cover specific diseases. And the way I explain it to my patients is really, I'm doing a bit about different systems. If I discover you have a problem with your liver enzymes, then we need to do probably few more tests for your liver. Then you have to come back. So the screening has to be as much as possible general. That includes your blood count, your liver, your kidney, your diabetes, your cholesterol, your prostate, your hormones, your breast, depending on your gender and age. So it has to cover your vitamins. So it has to cover as many systems as possible. Your thyroid, common things that happen. People forget about the thyroid or forget about B12 deficiency. So I like to screen for it. If I discover, for example, that the man is coming to see me has B12 deficiency or iron deficiency, then we start wondering why. Is there a problem in their digestive system? Are they not absorbing? Are they not eating healthy? Or they're losing it, which means something serious. Then we have to go to level 2 and we start investigating deeper. And as I said, I'm an internist by training as well. So I like to go deep into the history and try to dig deeper. And then if I feel they need to go specialist, of course, I mean, I won't hesitate to send someone to the right doctor and guide them in that treatment. But in terms of screening, the point is that those conditions I mentioned, liver, kidney, diabetes, cholesterol, they're silent diseases. A lot of people will not know. I had a friend who I play football with regularly, very fit guy. For 2 years, he let go. He admitted he let go. He went to do a test just because his wife was doing it. He wasn't interested, but his joke was like, well, the insurance covered it. Why not? He was diabetic and quite poor diabetic. Now, that guy did amazing transformation in his lifestyle, stopped eating the stuff he was eating between 9 and midnight, 9 p.m. and midnight. He's not diabetic anymore. He's not on medications, and that's very important. He just changed his lifestyle. He's 44 now. I won't say his diabetes is controlled, because to me he's not diabetic anymore. And that's very impressive, okay? And that's why it's important. If he didn't do that checkup that time, 2-3 years ago, he would have not realized he's diabetic. Today he would have come in because maybe he had a heart attack or problem with his kidneys because of that diabetes. And that's the beauty of those checkups. Discover things very early, we tackle it, and we make it better.
Brilliant.
Magician.
This is brilliant. And I want to reassure the people that these checkups, it seems, they are like as if a holistic approach to everything. And we know that many diseases, the percentage is very high in our region. And this should not be really, and can be easily, these percentages brought down by these checkups. And that's why we are highlighting the importance of these checkups. Many of the diseases that we have, or the conditions that our people are having at these days, can be really maybe prevented or like treated at an early stage. And
we have more than 200 nationalities in Dubai. We have to understand the difference between people. Like diabetes is prevalent in this region and in sub-Indian continent. B12 deficiency is very common, and thyroid disease in the sub-Indian continent. People of European descent might have other diseases like celiac and other conditions. So that's why it's important.
Fatty liver disease, a friend of mine was telling me, a gastroenterologist, like 45%.
Fatty liver disease is very interesting, actually mentioned it. Fatty liver, now this is probably revealing my age, is that when I was still a medical student, we used to say, oh, you just have fatty liver, no problem. I said Irish are well known for kind of over-consuming alcohol at times. So the biggest issue for us when I was still a medical student and a junior doctor was alcohol liver disease. Now we know that by the year of 2050, fatty liver is going to overtake alcohol liver disease as the reason for liver transplant. 20 years ago, we used to think that, don't worry, you have fatty liver, go home. So that's very important, because medicine changed, and now we have to prevent it and we have to treat it. And the only treatment for fatty liver is weight loss and healthy eating. Right. So that's why I spend 10 minutes lecturing people about exercise and eating habits and sleep.
Yes. And with the advancements of medicine, like the new medications we mentioned in a previous podcast about them, like the 𝗠𝗷𝗶𝘀 𝗪𝗀, they are here to help, and a lot of interventions are there if they really come to the checkup, detect everything early, and then we will promise them with a better
And I promise I won't talk
result.
much about these injections, because I know my colleague did, and I know she's done a great job. But one message about these medications: they're amazing medications. They're very good, but the best way I describe them, they're a great, powerful weapon, very lethal in the wrong hand, and very useful under the right supervision and the right hand. And that's very important, especially now that every other person is deciding whether to take it or not on their own without guidance.
Very true. You mentioned insurance, like he doesn't have insurance, but or the insurance covers, let's go for the checkup. What if they don't have insurance?
Checkups are, some insurances have these yearly packages where they cover a couple of conditions, saying that you're allowed to do it. Depending on your symptoms, if you have symptoms, the insurance might cover your test. But those checkups are not kind of, what's the best way to say it? So it's not kind of, you cannot not do your checkup if you don't have insurance. So anyone who wants can check the website and check the right package for them, come see the doctor. And then, yes, we can do this kind of one-size-fits-all, in a way, checkup. And a lot of times, like I said earlier, we might actually have everything in this checkup for a very reduced price, cash payment, and then we don't need to do more. If we discover more conditions, then we can see if the insurance would help us, because now we have a medical reason to do it rather than just doing it for a screening purpose. And at the moment, most insurances still don't do the screening test unless it's part of the package.
Very true. So, and I don't think that anyone will not pay for his health if it's the most important thing we own in life, our health.
People are always afraid that these tests are going to cost. Trust me, I've looked at some of the cost. Sometimes
It's
actually I wonder like how people are making money, because when they're pulled together, they're way cheaper than anything else. And trust me, way cheaper than a month of these injections that people are taking without supervision.
Yes,
So
or treating a disease and getting a disease later on and treating it.
Yeah, because that's what we're doing. We're trying to plant a seed for the next 10 years. And absolutely, I prefer to know today I'm pre-diabetic, change my lifestyle, treat it, rather than 10 years being on 5 medications for my heart and my blood pressure and diabetes.
Very true. And you've convinced us. I will tell you, I'm convinced that these checkups are very important. So now I want to go to you. I want to prepare for my checkup. Anything from my side before visiting, because our time is limited. We are working and it's a busy life. So what does the person need to prepare or to do? Maybe fasting, maybe before visiting you and any family doctor.
I'm going to go a bit maybe philosophical about it. Initially I said, like, honestly, the first thing is that decide you want to look after your health. Book an appointment. And I'm not here to market my service or my hospital, because there are many good doctors in Dubai. And whether you want to come see me, whether you want to come see another family doctor or internist, just make that decision that your health matters. And today you're going to take an action. So take a phone call and then call somewhere nearby that you trust, a good health facility, and book an appointment. Then everything else will be explained to you. The nurses will guide you, the agent will guide you. But to answer your question as well, yes, patients need to be fasting. A common mistake that I see it is that people come in fasting for 16 hours. Okay, the problem with that is that now the numbers are what we call false negative. So they're a bit lower than reality because you're fasting for a long reason. I have another group of patients that the week they want to come do their test, they start behaving. So they start eating healthy, they start going to the gym. It's like, we are not here to judge, okay? And the human body doesn't work this way. So if you stop smoking 2 days before your checkup, your results are not going to be better, okay? We can still know if you have a problem or not. And then the last part that I see a mistake with is that people come in fasting completely dehydrated because they were told don't even drink water. Water is fine. Actually, I'll go even as far as maybe a bit more controversial. If you want to have your black coffee in that morning, I prefer that you have your black coffee and don't come to see me stressed, angry with your high blood pressure. This is fine to do the day of the test, but don't eat anything with sugar or with milk, because then it could affect your cholesterol numbers.
So thank you very much, Dr. Wael, for these interesting insights. And by this, we come to the end of the session. And stay tuned for our coming podcasts.
Thank you.